Welcome back to Cancer Buzz. Today we examine an issue the entire healthcare industry is grappling with: systemic racism. Conversations about the effects of systemic racism on health outcomes and the solutions that cancer programs can employ to address them deserve much more time than just a few minutes. So on this episode, we'll tackle just one aspect: the legacy of American healthcare's treatment of minority populations. Dr. Christopher Lathan is a thoracic oncologist, the medical director of the Dana-Farber Cancer Institute at St. Elizabeth's Medical Center, and an associate professor of medicine at Harvard Medical School.
These are hard things. And I think, we as clinicians always want an algorithm or a straightforward answer as how we are going to do this. And also there's different levels of comfort we have to acknowledge as individual clinicians with this. Not everybody can walk into a room and say, if you're taking care of a person of color and you're not a person of color, and start engaging on, gosh, it's been a really hard year, given all the things that's happening. It doesn't feel genuine and doesn't necessarily feel authentic. What I would say to practitioners when they're thinking about this is approach this like you would approach any other aspect of the experience of your patient. Authentic questions. If you're talking to them about things in their life that you normally do, daughter's getting married, son's graduating, or whatever it is your relationship is, and you wanted to try to address these things in that, therapeutic relationship, then I think it's okay to bring it up. Otherwise, I think you want to do most of this thought process outside the room as you check your own bias. When you hear about the patient, when you think about your actions regarding the patient, making sure that they have enough access. I think telehealth is a good example of this. You have somebody who you're saying, well, okay, we're going to just talk to them virtually, but they don't speak English. And just that's the place where I think we will have the most impact. I think you can follow your therapeutic instincts on how to address things with patients. But I think most of the patients of color are not expecting their doctors to come in and talk to them about bigger issues. They want to know that we're trusting them in the moment and thinking about them, with their disease, and that the bias is not going to be in the way of that.
Let's talk about clinical trials and the legacy that they have exploited Black Americans. How does that continue to affect today's research, particularly, obviously, in oncology clinical trials?
With medical oncology, which is a space I've been in for the last 20 years, we can see that patients have been excluded. And I think there's some historical legacy here. What's interesting is I think for those of us who are practitioners, we think a lot about Tuskegee, and we think a lot about medical history specifically. But I would say most individual, especially African-American patients, might not be thinking immediately of Tuskegee, but they are thinking about a history of experimentation and mistrust. So I think that when you engage with your patient population and talk about clinical trials, you really want to make sure that, again, your therapeutic bond is right and that you can talk to people and explain why the trial is appropriate and make sure that, that you give people the space to make the decisions. So what we found is that if you trust your clinician, no matter what the race discordance might be, then when that's suggested, then people consider it and they'll go on clinical trials the same rates as white folks or other groups. When you don't trust your clinician, then it's very hard to think about being on a clinical trial. And I think this is true not just for, Black patients, but also for other vulnerable groups and poor patients in general. I think it's just hard to understand. And if you can't explain the clinical trial and if it doesn't make sense to the patient and to the decision makers around them, they're not going to go on. But if your patient trusts you, then you can get past that. You probably are not going to have a long conversation about Tuskegee. You're going to talk about trust specifically.
So I think that practitioners will be discussing the COVID vaccine with their patients. And this is obviously a larger issue that falls on the responsibility of the federal government. Given all of that, how does that impact the decision among minority groups to get the vaccine? And how do you address that with your patients?
Yeah, this I think we can be very practical with. I think you want to give people the information that they need to make an informed decision. We're in a very strange place where people don't trust the information. There's information everywhere, but we don't trust it. And the sources of the information are not trustworthy. So if you're talking about the very communities at highest risk, and you want to convince them this vaccine is going to be helpful for them, I think coming at people with a whole bunch of facts doesn't always work very well, right? We know this in general. But I think trying to make sure that you say, well, what are your concerns? If somebody says no to the vaccine, I have this thing where I say, follow the no. So why is it? What are you worried about? Let's talk about that. And then you might be able to help them with the information. Maybe some of the information they have is wrong. right? And maybe then you can say, well, what I say to my patients is I really want you to consider this because these are the risks that you have for COVID. This is what we know about the vaccine. And sometimes you can allay some of those fears. And sometimes people just need to go home and think about that for a minute. And so that's what I think that we can do as clinicians is to make sure the information that the patients have is appropriate, right? And then I think communities tend to come back to you and will take this on. But there are some folks you're not going to be able to convince in the moment. And I think pushing at that moment maybe isn't great, but just saying, hey, this is the information. I'm worried about you. I want to make sure that you have an opportunity to get this. And let me just be able to answer questions for you.
Cancer Buzz plans to devote more episodes to disparities in cancer care. Be on the lookout for more conversations in the future. Next week, we look at how religious and spiritual guidance in cancer care has been affected by the COVID-19 pandemic. Until then, for the Cancer Buzz team, I'm Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.